Welcome everyone in the webcast audience. I'm Terry Maggedy, Chair of the Elder Law Committee of the Trust and Estates section. And the first thing we do is go to our sponsors, because that shows our appreciation of them. And then we'll carry out the details in the program and other announcements right after that. But our first two sponsors will speak for themselves, and the other ones I'll mention right afterwards.
Good afternoon, everyone. This is Brian Joy from the Sanborn team. Everyone keeps asking how things are going with the Sanborn team. Well, we are officially back in the office and extremely happy to be here. In the last year, we've completed more than 15 court-confirmed sales. It's interesting that in Los Angeles, you must appear in person, whereas other counties, you can appear remotely. The good news is we've perfected both. If there's anything we can help you with from a property profile, a value letter, please don't hesitate to contact us. Thank you again for all of your support, and I hope you enjoy the meeting.
Hi, everyone. I'm Orit Gadish, broker and owner of Geffen Real Estate, a dynamic brokerage specializing in serving the trust and estate community. Selling probate real estate doesn't have to mean selling a property that's a fixer. There's no probate code that dictates that. If you or your clients, the heirs, the beneficiaries, would like to maximize the return of a property sale while mitigating your liability, it can be done. If the estate you're managing doesn't have funds to pay for a renovation or a trash out, the cleanup of an overgrown yard, or emergency repairs that must be made, not to worry. Payment will be made through escrow. If you're a practitioner, attorney, executor, or administrator, feel free to check out my book on Amazon titled The Practitioner's Handbook for Probate Real Estate. The link is in the chat box. Enjoy your program. Barry's great. I've known him for many years.
Now, our next sponsors I want to mention. First, Glen Oaks Escrow, Marcine Klein, also specializes in probate conservatorships, elder law matters, well known in our community. Thank you, Marcine and Glen Oaks for being our sponsors. And also California Title Company, again, a title company that works in our field, trust, probates, estates. Thank you, California Title Company, for being a sponsor. And finally, our newest sponsor, Manufacturers Bank, also in the trust and estate space. Manufacturers Bank is a bank that deals with, again, as with other sponsors, the areas that we all work in. So thank you, Manufacturers Bank. And a reminder to everyone, you're going to get your MCLA confirmations right after the program, should be within 24 hours. That's the goal. You should have gotten an email with program materials, but I believe they're also going to be posted for you. And our next speaker is going to be May 26th. Again, niche, as we've been doing for a gazillion years. The first part of the title is older people are landlords too. It's people don't appreciate it, I don't think, because you always think if you're dealing in the area of elder law, oh, you're looking at things from a tenant's perspective, a poor person's perspective. Actually, for those of us in the field, I know for myself, almost all of what you do is dealing with real estate for fiduciaries, for older people, from a landlord's perspective, because older people rely on that income, and for sure, fiduciaries for people with disabilities rely on that income. So we're going to have a speaker talk about for Tenant Relief Act, people are probably familiar with. Also, there's a new state, county, city rent subsidy program. He'll address that. And he is 100% on the landlord side, evictions. So we're going to present that perspective, but with a focus on our clientele, which is all the fiduciaries we represent, and the older people, moms and pops a lot of the time, with an apartment building. So with that, I am now going to go over to our program today, and that's with Barry Sikov. Barry is a regular presenter in our group. He is top notch. He's going to be talking about migrating into Medicare, but Barry is so knowledgeable about so many insurance issues. I've worked with him on many cases, and it's just a real pleasure to speak with someone in the industry who really has a lot of technical expertise. So it's really nice to have him on your team. That's been my perspective. And also, he has a gift for simplifying all these concepts that even a unsimplifying attorney can grasp onto. So we've always enjoyed his presentations in the past, and we're glad to have him again for the next, it's 50 minutes or so, turning the program over to Barry Sikov, who's going to speak with us about special insurance issues. Barry?
Thank you, Terry and Norit. Thank you for your kind words. I'm glad to be back here and trying to help everybody here understand a little bit about the world of Medicare. So I'm going to go directly to our screen show and start that with you. Hopefully you all see who you are, the part of the Beverly Hills Bar Association. And I'm going to go through some concepts with you today. So let's just, before we get into the meat and potatoes of this, many of you are well under the age of 65. You may know people that are pre-65 that have had a disability and may have qualified for Medicare early, or you may be working to the age of 85 and then finally saying, I've had enough of this. I'm going to retire and finally go back into the world of Medicare after being on group insurances. So as you can see, there are lots of questions. I'm turning 65, and do I have to even enroll in Medicare? I'll talk about that. I'm still working and turning 65. Should I keep working? Should I not? Well, there's a math game involved in this one. I'm thinking about retiring, but can I afford to? And then Medicare, what's it all about? What are the main differences in the plans? Will I be able to see my doctors? Will my medications be covered? So many questions that you folks have. So as you tune in today, we're going to show you in the next 50 minutes how that works. And I've named our conversation today as the ABCDs of Medicare. So a little bit of an overview. So as you begin, you'll see that Medicare is made up of two major parts, parts A and B. It's referred to as original Medicare, and there are costs associated with it. There are specific times when you can apply and enroll in original Medicare, and then many of the Medicare plans will have options that you have to deal with. So a little bit of history. Everybody remembers LBJ, but little did I remember that he was the president that signed Medicare into law. And who received the first Medicare card? Yes, President Harry S. Truman, first beneficiary. Wish I could get a copy of his original card, but as you know, they had Social Security numbers on it, so it wouldn't be all that interesting to look at. But Medicare is operated by the Center for Medicare and Medicaid Services. The gateway to Medicare, how you get into it, is through another government branch called Social Security. Many of us think of that as strictly money, but it's actually the gateway to get into Medicare, and then they deal with the premium side. We'll talk more about that as we progress. All of this falls under the United States Department of Health and Human Services. So a couple of just simple terms to talk about in general. Everybody knows the term premium. That's what you pay for your insurance somewhere. And yes, you are paying for Medicare. The good news is you're going to learn more that you've already paid for part of it, but there's part that you still get to pay for. And then once you have a policy of some form, there may be a deductible. And that's what you pay before the plan really fully engages. Co-pays are things that you pay along the way. You share the cost with Medicare. You might have a doctor visit copay, or you might pay a percentage, or you might have a supplement that covers that. And then co-insurance, of course, is the percentage that you share of every expense that you deal with. Medicare is a single-payer healthcare system, and you're going to hear a lot about that in the next several months from the state of California. There are some bills pending talking about should the state of California go to a single payer healthcare system. So I'll stay out of politics for now, but if you want to talk about it, we can do that. So let's begin. As I look at those that I saw on the screen before I started, it's interesting that I never think of myself as being the oldest dog in the room, but it appeared I'm one of the older people and I am a card-carrying member of Medicare. I've been on it for many years, and it is truly the greatest health plan in our country. It's made up of 4 components. Part A, think of that as hospital insurance. It's predominantly inpatient, and it works directly opposite what any of your current health plans work like right now. So I'll give you an example. If you can see my face in the pictures, I'm going to use a little visual tool. Think of my hand as the health plan you may own prior to getting to Medicare. My thumb is a doctor visit copay. My next finger would be your lab copays. The next finger would be more expensive things like CAT scans and MRIs. The fourth finger would be hospitalization, and the fifth finger would be prescription drugs. And it all fits into one nice, neat policy. That policy could be an HMO, it could be a PPO. And so as we relate to where you're coming from to where you're going to, the health plan called the Affordable Care Act, or Obamacare, has built this consolidated plan. And think of my wrist right here as a maximum out of pocket. That's the most you pay to use whatever you own today. And if you follow my arm down to the elbow, that's where your insurance company is. So that's a physical, visual representation of it. And then I've got another hand. So Medicare has 4 distinct separate policy forms: Part A, Part B, Part C, and Part D. So let's dig into Part A. So first of all, should you blow out your appendix and end up at Cedars-Sinai or one of the other hospitals, you end up in the hospital, you have your surgery, whatever time you do that. You'll probably be in the patient, as an inpatient in the hospital for 4 or 5 days when it's something as major as a appendix removal. But some of the surgeries are done outpatient. So let's relate again to my hand to your coverage. In a hospital setting with your health plan, let's say you're due to have a surgery for your appendix or for some other surgery. You check in at 6 p.m., your surgery's at 8 p.m. The doctor says you're going to be here overnight and then you'll go home in the morning. Well, remember 6 p.m., that's when you checked in, and you go home at let's say 10 o'clock or even noon the next day. Well, to your health plan, you are considered an inpatient hospitalization. To Medicare, it's a direct opposite. It is not an inpatient because Medicare looks at the clock and they say, well, you weren't here 24 hours, so we're going to bill it as outpatient. And why do they do that? Because they can. So in a hospital, you'd have your surgery, you'd have a recovery room, you'd have skilled nursing care after the surgery. You go home and you may have some stitches on your body, and you might need a nurse or a doctor or somebody to come and check you out at home, make sure everything is okay, no infections to the surgical site. And while you're at home, they might need to give you a shot or an IV. So that's called home health care, not to be confused with home health care. That's the 4 hours to 8 hours to 24-hour care. It's totally different. This is a 1-hour visit. And Part A also covers hospice. My personal goal as I'm getting older is that I hope I die as a light bulb. Just simply I go out and that's the end of it, that I don't linger. But sometimes we do get the notice from our doctor that we're not going to get better, and hospice in California is brought to your home. And that's the good news. So you have your family around you, your friends, your pets, and you know it's bad enough to know you're going to die, but at least you're not going to a place to die and knowing you'll never see your home or family or friends again. And so what does Medicare Part A cost? Well, for almost 99% of our society, it costs nothing. Every time you get a paycheck, you're paying into that fund for Social Security as well as for Medicare. So it is an entitlement. So you've noticed in our last election, after we narrowed it down to Biden and Trump, they stopped talking about entitlements and wanting to change entitlements. Kind of interesting how politics works that way. So we're entitled to that for a very simple reason. We've already paid for it. And in most cases, you pay zero premiums whatsoever. But sometimes people immigrate to this country, and after they're here for 5 years, they may want to buy into Medicare. So there is a system in place for that. Part B, everything you do as an outpatient. So let's give an example that when I talk about myself, because of COVID, I did not get my last colonoscopy. Last April, I was supposed to do that. My doctor said, no, we're going to put that off until things calm down. So I'm hoping this summer I'll catch up on that. So I will go into a place like Cedars in the morning, have my colonoscopy, go home at noon, and it'll be fully covered by the Medicare system. So outpatient care, I went into Cedars-Sinai, but I went home, so it wasn't an inpatient. So it's an outpatient expense that falls under the labs. Hopefully you can see my cursor here. If you needed various types of therapy, physical therapy, radiation, speech therapy, any of these things, even chemo, those are outpatient and it's covered by Part B. Durable medical equipment. I've dealt this morning with a patient that needs a portable oxygen concentrator. You've seen people wearing a shoulder bag that has a machine that's battery powered that purifies the air and concentrates it into more oxygen with a little hose going to the nose. That's covered as durable medical equipment. And in most cases, your preventive care is covered, including vaccinations. But notice at the very bottom here that Part B only covers 80% of the cost. Oh, too fast. So in terms of the cost of Part B, that's one of those parts that is not for free. So everybody today, because it's 2021, looks at their federal tax return. And when you go back and look at your modified adjusted gross income from 2019, any of you technical people that like this stuff, it's a Form 1040, it's line 8B at the bottom. This year and last year it was in small print instead of being adjusted, modified adjusted gross as capitals, they put it in small letters. I guess they ran out of capital letters. So at any rate, that number is what is used by Social Security to determine your cost for Part B. And just like the federal tax system that we have, the more people that make more money, you can afford a greater share of your taxes. When it comes to Medicare Part B, the same exact thing is there. The more you make, the more you can afford to share in the cost of B. And when you're sharing for B, you're also sharing for Part D. Today, for this calendar year, $148.50 is the minimum, unless you're able to qualify for some of the state assistance programs I'll show you later. And Part B, most people today that retire at 65 do not elect Social Security. So you'll get a bill in the mail and you can pay it online. You can use a check or a credit card. Yes, you can get frequent flyer miles or points with your credit card, no extra fee when you pay for your Medicare through Medicare.gov or through the paper that they send you. A couple of more details. Right now in the United States, there are over 15 million people, not necessarily all seniors, but the vast majority, that are on Medicare supplements. And a Medicare supplement will help cover the cost, the 20% cost that's not covered by Medicare. There are out-of-pocket costs such as co-pays and deductibles and coinsurance. And today there are letters A through N with a couple of the common ones listed here. Plan F, G, and N are the most common. Just a bit of information for the technophobe as well, that the macro law, which is one of the updates that were done under the past administration, adjusted the Medicare system so that Plan F is now closed for new people enrolling into Plan F unless your birthday was before January 1st of 2020. That's when you turn 65. So some of you have Plan F and it's still alive and well, will stay available forever, not going away. Premiums change on it, but F is available to those that turn 65 prior to this age. Today, the highest level you can buy is Plan G. Talk more about those in detail in a little while. These Medicare supplements are sold by private insurance companies. You all know the names. They could be blue, they could be green. There are all different companies out there that offer that. The premiums that you pay for a supplement are based on several factors. Number one, how old you are at the time you apply and what your home zip code is, and then the flavor or the letter, whether it's an F, a G, an N, whatever flavor you want. There are different prices for that. These are referred to as original Medicare supplements, and then you add to it a prescription drug plan. Keep in mind that in order to buy a Medicare supplement, you have to have parts A and B. Just a sidebar for all of you, that you have a Q&A bar at the bottom of your screen, as well as a chat. Feel free to write questions in there, and at the end of my presentation we'll save about 10 minutes where I can answer your questions specifically. If it is a personal question, you'll see in the chat I put some information on how to reach me, and I can consult with you at absolutely no cost or fee of any kind to answer your personal question for your situation. Just want to remind you of that. So what do you have to do to qualify for Medicare? Well, very simple reasons and rules. Age 65 or older, and unless you have specific disabilities before 65, then you may qualify for early Medicare. Typically, if you are disabled, God forbid a car accident, or have a major condition hit you and you're disabled, depending upon what that condition is, after you're disabled for 24 months, you can qualify for early Medicare. And that's a wonderful feature. End-stage renal disease. You've heard of people having dialysis. This is the first year that the federal government changed the law and made it available that people that have this can now get any form of Medicare they want. It used to be very restricted. And now you can get a supplement or an Advantage plan, and you'll be covered at any age that you want to be. ALS, you've heard of Lou Gehrig's disease. Within the first month of that, you don't have to wait for 24 months. Reason why, pretty simple. You probably won't live 24 months. It sounds a little gruesome, but that's the reality of it. You do have to be a U.S. citizen or nothing less than a legal resident if you've immigrated here and have been here at least 5 consecutive years. How do you apply for Medicare? Well, the first one, I keep it on the slide just to show you that yes, the Social Security offices will open again. I can't tell you when, but right now they are closed to us to walk in off the streets. There's one on Olympic, just on the west side of the 405 freeway. And it's a wonderful office, easy to park, easy to get to, but they're closed for us for now. So you would go to ssa.gov. On the ssa.gov website, that's where you would apply. And there's a procedure for doing this that I'll talk a little bit more about. And then ultimately, you can call Social Security, set up an appointment, because the first call just gets you in the door. Then you need an appointment, and that agent can enroll you over the phone. Sometimes you have a special enrollment period, and this is very subjective to what the circumstances are. So circumstance is a very, very important detail of Medicare. Unlike your regular health insurance, you get a job at a company that offers health benefits. They have to cover you in California within 90 days. So you've got a very finite enrollment period. And if you miss that 90 days, you're simply out of luck until the open enrollment the year following. Medicare is open all year long, and you can have different circumstances. So for example, many of you may be on a group insurance plan. Either you own the company or you are an employee there and you're being provided for as an employee benefit a health plan. It could be for you and your dependents, or just you. Or you could be the owner and it's just you and maybe 1 or 2 other staff members. Well, while you're on the group plan, you do not have to enroll in Medicare. You can stay on the group plan. But when you retire, your coverage will be ending when you leave that job, whether it's your own or another company. You have up to 8 months after employment ends to enroll in Medicare, but nobody waits that long because you can't afford to be uncovered for 1 day, let alone 8 months. There's rules that apply in Medicare that are designed to help you go directly from point A to point B or policy A to point B And I'd like to bring to your attention this last comment, that because you have prescription drug plan on your health plan that you have now, you can't go beyond 63 days of when you lose that coverage to join a Part D drug plan. If you do, you will be subject to a late enrollment penalty. And when your coverage will begin on the first of the month following. So these are the new Medicare cards for those that haven't seen it, where you see this alphabet soup, the numerals and alphabet letters. It used to be a social security number, so yes, the government finally heard everybody's plea about privacy and getting hacked and all these other things that happen when people lose their wallets. So now this particular card is what they look like. I do not have any idea of one number or letter on my card. I have no desire to know it. I don't need to know. I just pull out the card and use it. And it shows you when your hospital, your Part A, and when your Part B starts. Some people say, well, that's all I want. I'm not going to buy a supplement. I'm not going to buy an Advantage plan. But you are required to buy a drug plan, PDP, prescription drug plan. Today, there are only 32 choices. So I will help you guide you into that choice, or other people like myself. The person that says, I want to have as good a coverage as I had when I was on my group insurance, if not better, will then start with original Medicare and then add a Medicare supplement and a prescription drug plan. So yes, you would have 3 cards in your wallet. And then there are some people that simply say, well, I've paid taxes my whole life, I've worked my whole life, I just don't want to pay any more premiums. I want to just have the easiest, least expensive way to be covered with Medicare, and that is called a Medicare Advantage plan. So you'll notice here, it's an HMO. Where we are sitting in California today, there is one company offering a PPO, but it's not priced for being sold in LA County. In other counties it works very well, but in our county it's not. There's too much competition in other areas. So most people go with an HMO if they're going to do this. Keep in mind again that you still have to pay for Medicare Part B. The A we get for free, the B we pay for based on our income. So speaking of Part D and the drug plan, the federal government does require that all beneficiaries of Medicare have at least a minimal drug coverage plan. There's one on the market for $7.20 a month. There's also 31 more choices that range all the way from $7 up to $130 a month, and they are all competing for your business. All 32 plans have this thing called a formulary, a book of drugs they're willing to cover, and they're all being offered by different insurance companies nationwide. They all have a monthly premium, anywhere from $720 up to $130, and they all have tiers of payments. So back to a visual, if you can look at my fingers, I'm going to start off with holding up 3 fingers on my face, in front of my face. Your current insurance plan has a formulary, it doesn't matter what brand you have, and if it has a drug that's a generic, that's tier 1, it's in the book. And if it's in the book and it's a name brand, that's tier 2. And if it's not in the book, it could be an injectable or biological, whatever, that's a tier 3 drug that's not in the book. So you have today 3 tiers. Medicare said, well, we want to control the cost of what we as the government pay for your prescription drugs, as well as help you control your cost of copays. So yes, there are 5 tiers. And all you need to know is tier 1, my thumb, is the lowest cost, tier 1 is the lowest cost, tier 2 is the second lowest, and tier 5 is the most expensive. So when you get a prescription drug, you'll want to guide your doctor into prescribing something that will solve the medical problem, but will solve it for the most cost-effective price if possible. And you want to have the doctor control your health care and you control your wallet. And yes, you do have an influence on that. A lot of doctors will only prescribe name brands because that's how they think. Or one of the pharmaceutical companies has given them some type of an incentive to inspire you to use the name brand. But where you can, a generic will be to your financial benefit. Medically, it has to be equivalent. So as we look at Part D, you can get a freestanding plan. or you can get it attached to a Medicare Advantage plan. In the world of Medicare Advantage, uh, what you're doing is you're going to an HMO company, and you all know the names of many of the HMOs that are out there. For the sake of our education today, I'm not allowed to mention any brands, but there are several. There are 59 choices in LA County. Yes, 59 choices. If you can figure out which one to go to, by all means, just go there. You won't need any help from an advisor. But most people say, well, what's the difference? And I want to go back to my hand as talking about that group insurance now. So remember, I was saying you have a max out of pocket, but I didn't mention what's between these two, between my wrist and my elbow. Well, every carrier that you have, the elbow, the carrier, has a contract with different hospitals and different doctors, different medical groups, and different providers of ancillary services. So in the world of the HMO system is set up where now your doctors are contracted with a medical group. For example, Cedars-Sinai Medical Group, St. John's Family Physicians, and there are hundreds of different ones all over the state. They're all geographic. But what's interesting about them is that the carrier, the insurance company, contracts with a hospital, the medical group contacts with the same hospital, and so it's very closely integrated. So when we look at a place like St. John's on the west side, there are only 2 insurance companies that have a contract for Medicare Advantage there. And then we look at a place like UCLA, right now there are only 2 companies out of all 59 that are contracted there. Cedars-Sinai, there are 5 carriers. And that's mainly because of them being in the center of the city. They had to contract with more companies to allow for different populations. So when they contract, you still have to have Part A and B for Medicare, but you're basically going to assign the benefits to the Medicare Advantage company. And the prescription drug plan will be included. A lot of the Medicare Advantage plans cost nothing to buy, but unlike what we have in the Medicare supplement world and what you have in common right now with your group insurance, is all HMOs have out-of-pocket maximums. So if you're back to my fist, your group insurance has a maximum today. I believe the highest price is $8,200 out of pocket. And with the Medicare world, the highest price now is $6,500 as an out-of-pocket maximum. If you are on A, B, and a supplement, you have almost nothing out of pocket. You pay a Medicare Part B deductible once a year of all of $203, and that's it. Why? Because you buy a supplement and the insurance company insures that with you. So in the world of Medicare Advantage, you do have copays, and you have out-of-pocket maxes and percentages and all kinds of bells and whistles. And in the world of the HMO, you have the contract or network doctor that has a contract with the medical group, and the medical group contracted with the hospital, and they now step into the role of Medicare administration. Your A and B, you still get your A for free, you still pay your B to the federal government, and now your Medicare carrier, whoever they may be, will cover and handle all of your billing and all of the insurance needs. So that everybody there has to be contracted with the carrier. There is no out-of-network benefits. I'm over here. These are all sold by private insurance companies, and they are not in any way, shape, or form the same as a Medicare supplement. They're directly opposite. And yes, you must be enrolled in both Part A and B, so the B cost does not go away. I had a lady that asked me this morning, she said to me, Barry, I've been paying my entire life. Why do I have to pay now? And I said, it's real simple, because that's how Medicare is built. They give you and cover the most expensive parts, your hospitalization. But for outpatient care, because you're going to want to choose where you go, you get to share in the cost. And it's not a lot compared to group insurance. She's coming from $1,000 a month individual PPO right now, and her total cost would be $148.50 plus whatever the supplement is, which might be another $150 $150. So for maybe $300, she can go to any doctor that takes Medicare, and that's it. Or she can go to an HMO and have no premiums to pay. So I'm sorry, just going too fast here with the mouse. Let's just go here. All right, so let's talk about when you can make these enrollments. So you have what's called an initial enrollment period, a special enrollment period, an annual election period, and an open enrollment period. I'll do more details for you in a moment. But everybody's heard the HMOs and the PPOs and the IPAs, and here's some more alphabet soup for you. Initial enrollment periods, SEP, special enrollment period. So let's look at some details. If you look at your initial enrollment period, that will occur 3 months, and it begins 3 months before you turn 65. So for example, if you were born on April 1st, then on January 1st, you would typically start your enrollment period called the initial enrollment period. However, I've made a very specific date that I chose. I said April 1st. Our government says, well, Barry, because you're turning 65 on April 1st, we're going to give you a special opportunity. You can start your Medicare 1 month early. So in my case, if I was born on April 1st, April Fool's Day, by the way, I could have actually started my initial enrollment in December. But most people are not born on the 1st, and so you start 3 months before, and there's a procedure of how you register for Medicare. You have your entire birth month, and then you have 3 months following to do that. And that's if you have an individual health plan, you're not part of a group plan. And then when can you enroll in your supplement? Well, once you have received your Medicare card, you would then talk to an advisor like myself, and we would then help you determine what's the most cost-effective Medicare supplement for your specific needs. The date that your Medicare starts, so in my case, not April 1st, it's actually going to start March 1st, so my supplement would have started March 1st as well. And you have a 6-month window to enroll in the supplement, after which you have to answer health questions. So there are no pre-existing clauses in Medicare. No health questions. They don't ask you if you're a smoker. They don't ask if you're a drinker. You can enroll in any supplement from any carrier, and it'll start the same day your Medicare starts. A visual of this is, you'll see April right there when I had my birthday. It's not really my birthday, but I'll just use that for example. And this gives you a feeling as to what the range of time is. There are special enrollment periods, and this is commonly referred to as special reasons. So it's not uncommon that you hear about people moving out of the state of California. I heard in the news yesterday that they were announcing that we may be losing 2 of our seats in Congress because our population is not as big as it was. So that's an interesting concept. When you move out of state, you have the opportunity to make changes to Medicare. Some people have lost their jobs and their income is down, so they may become eligible for what we call Medi-Cal. Here it's called Medicaid in all the other states. California has to put their label on it. That would allow you a special enrollment period when you all of a sudden qualify for both. And then those of us that work, and I'm now 72, I don't plan to retire. I don't have any reason to retire. I thoroughly enjoy what I'm doing. Every case I have, like every case you folks have, is a different case, and there's always something intriguing about it. So it's very stimulating to keep the mind active. And besides which, I tell people I don't play golf and I don't play tennis. So I want to do something that is mentally stimulating, and that's what Medicare is for me. So when I finally retire, if I didn't have a Medicare already and I was on an employer's plan, then you get a special enrollment period. And there's some very specific laws, so all of you being attorneys, I'll bring a couple of them to your attention, that you see a little red triangle here. When you are on group insurance and have no longer a plan to stay on that for whatever reason, COBRA is not an option for you. COBRA and then also retiree health plans are not considered creditable coverage. I'll talk about it in just a moment. When either of these two coverage ends, you will not be eligible for a special enrollment period, and you may incur a late enrollment penalty. I didn't mention when I talked about the drug plan that late enrollment penalties are not good because you pay them forever. Once you are eligible for it, you will pay that penalty forever. And it could be a significant amount of money or it could be a small amount of money, but it is a nuisance that you have to pay forever. That's the law. So when we talk about group insurance, I hate to use a political term, but I will. The group insurance plan today trumps Medicare. As long as you're still working and you are on an employer plan, if you choose to join Medicare right after that, then you will not have a late enrollment penalty. But that's because the strength of the group plan is as great as the strength of Medicare. So as you can see, when you leave it, you cannot elect COBRA, and COBRA is not creditable coverage, meaning it's not as good as what you have when you're on Medicare. If you are enrolled in an individual health plan as a person just self-employed or whatever, the option for an Affordable Care Act when you retire from a job is not there. You can't go there because Medicare trumps both COBRA and the Affordable Care Act. You have to, and one very important thing here, a lot of groups have gone to high deductible health plans, HDHPs, and if you have one of those and you, for whatever reason, chose to enroll in Medicare Part A, you have to be very careful because it's called double dipping. We can talk more about that later. So let's look again at the windows of time. We're going to talk about the next window, which is what happens every year. In our office, the last week of September, we send out a couple of emails to each of our Medicare beneficiaries and find out what medications they're taking for the new year, because you have an opportunity to make changes. So the annual election period will happen from October 15th to December 7th, and that's when you can change your drug plan or change your Advantage plan, or better yet, you might say, well, I'm going to give up the drug plan and supplement. I want to try one of those HMOs, and that's when you can do it. And the effective date will be the first of the year following. Then there's another enrollment period, and this is one that is easily confused. I had a very unusual situation with a law firm that one of the employees, husband and wife, were both on COBRA because the wife was under 65 and the husband turned Medicare age and he dropped COBRA, went into Medicare. But the wife was on the plan with California, with COBRA in the state of California from the company, and she used up her first 18 months, went into what's called California COBRA. And the California COBRA allows her another 18 months, and then in the end of this year, she'll turn 65 and go into Medicare. Well, many HR departments don't know that there's something called California COBRA. So this law firm that has 18 branches, one in Nevada and 17 in California, the HR person never heard of Cal COBRA. Nobody ever goes that far in the Medicare, in the COBRA world. Well, sure enough, it applied for her, and I was able to provide the documentation and help her make that change. So the open enrollment period is when people make changes as well. So you might have said, well, I chose an HMO back in the last window of time, October 15th to December 7th, and I just found out none of my doctors are in the plan I changed into. Well, that's okay. You would call an advisor like myself and we'd help you figure out which plan your doctors are in and you can make a change. And then there's some people that said, well, my friends all talked me into that HMO thing, and then I decided, well, wait a minute, none of my doctors are HMO doctors. I think I want to be able to choose my own doctor, so I'm going to disenroll that from that Medicare plan, and during this window of time, you can do that. You switch back to Medicare, to original Medicare, buy a supplement and buy a prescription drug plan. However, there's a catch. The catch is depending upon your history of time when you did what, you may have to pass medical underwriting to go back to a regular supplement. It's not guaranteed, and that's what advisors like us know all about. So during this general open enrollment period or general enrollment period, this is when some people out there, for whatever reason, enrolled in Part A and missed enrolling in Part B. They just forgot about it. They said, I'm so healthy, I don't go to the doctor, I don't even use doctors. Why should I buy Part B and have to pay a premium? Well, there's a window of time when you can enroll in Part A or B if you missed it for the first time. And that's January 1st to March 31st. And as you can see in the orange box here, that's when your coverage will start. And in almost all cases, there will be a late enrollment penalty. In the state of California, we have, as well as throughout the country, there are different kinds of benefit plans that can help you with the cost. So I mentioned Medi-Cal. You go to the DPSS, Department of Social Services. That's where you can find out about Medi-Cal, or you can go to Medicare Health Savings Plans, benefits.gov, or you can look and apply for extra help. There is an envelope that automatically will be sent to you by the federal government when you're new to Medicare, and it has a form that asks you whether you think you might want to apply for extra help. And that helps you with your Part B premiums. It could help you with your Part D premiums, and it could help reduce the cost of your drugs as well. So there's an automatic process available that comes from the government to you. These are some of the options that are available. Now, in terms of how to go about choosing all of this, if you think it's confusing so far, I haven't shown you all the details. There are lots of slides that I would normally show I've used in the past for the Bar Association. I chose today to try to make it a little more simplified version, but there's a lot of details. And when I, as an advisor, speak to somebody, I find out, well, how often do you use your health care? Are there specific doctors that are important to you? Would it bother you if you only had a specific set of doctors open to you, as compared to having freedom of choice? Are your medications covered, and can you afford to pay for them? And I notice half the people out there are wearing glasses, and some of the people are hard of hearing, and everybody has teeth. Do you need coverage for dental and hearing and vision? These are all options within the Medicare world. And then some of you, hopefully all of you, have planned ahead and realized that sometime in the future you may need somebody to help you at home if, God forbid, you have a stroke or come down with a debilitating condition and you're disabled and can't go to work and can't go out and go to doctors, so you may need long-term care insurance. It's a very important tool. I own several policies, 2 for me and 2 for my wife. Licensed insurance agents like me. First of all, if you didn't know already, there's no cost to use my services. I'm paid by the insurance companies, and all of the companies out there pay me exactly the same, excuse me, the same way. Thus, when I am looking at recommending a policy, I am totally neutral. I do not have to worry about what's right for Barry. I have to worry about what's right for Terry and Orit and Brian and any of the rest of you that are there. Everybody has specific stories, and that's what's intriguing about the Medicare world and why I don't want to retire, because I like trying to figure out what fits. I'm a professional matchmaker. Not that kind of matchmaker. You're on your own picking your mates, but I will match you up with the right health plan. I am trained and certified every year. I have to take national boards, and we have an exam that's 150 questions, and we are only allowed 2 of them wrong. I have to have, 3 of them wrong. We have a 90% pass rate. That's what the requirement is. All of our exams require that we know this stuff as licensed advisors, completely inside out. And 90% is passing, not 50, 60, 70, 80. All carriers have training classes, certification classes, and all of the health plans require that we all get trained and certified. Because of our licensing and who we're dealing with Medicare beneficiaries. We have to be licensed and authorized to provide the advice and the assistance. And best of all is we do all the research for you. I gather the data, I then come back with all sets of options ready for you. And thanks to the inventor of Zoom and Teams and all of these other WebExes and what have you. It's all done online very painlessly today. At this point, that's what I look like. Will I ever wear a tie and suit, sport jacket and a suit back in the office? Well, I'm certainly hoping so. I put on a tie just because I'm dealing with all of you other professionals today, but that's how I normally look, and I'd be delighted to help you in any way I can. If you just simply have a question and want to pick my brain, there is no cost and no fee of any kind. Someday in the future, I'll be able to help you. So at this stage, I'm going to leave the screen sharing open, and I'm going to open up, let's see if I can go here to the Q&A. I see that there are a couple of questions here. Total coverage would be under Part A. So the first question from Susan, if you're in a hospital overnight, but less than 24 hours total, coverage would be covered under Part B and not A, and that is correct. That's under Medicare. Under your group insurance or your Obamacare, it's covered as an inpatient hospital. What about old grandfathered policies from a company I can't mention? I don't know what Linda is asking there in terms of the question, but on any kind of a Medicare supplement and anything dealing with Medicare, if that's what you're coming from in terms of this grandfather question, then it's exactly as I mentioned for Susan. If you have, excuse me, if you have a grandfathered pre-65 health plan, they function mechanically the same way as an Obamacare or Affordable Care Act plan. That the clock changes, the date changes, that's inpatient. You go from the 27th of April and you're there until 3 o'clock in the afternoon or 3 o'clock in the morning. It's an inpatient when the date changed. So it's the date of service. Another question, if you signed up 3 months before your birthday, when does it take effect? Right away on your 61st birthday. Well, the answer is no. Your birthday is only a measuring stick. So if your birthday is the 27th of April and you had signed up for Medicare when you should have, your Medicare actually starts on the first of the month that you were born in. Except in my example, I used April 1st as the birthday, so I had the privilege of starting a month earlier. So Medicare starts on the first of the month only. Your supplement, your Advantage plan, your drug plan all start on the same first of the month. Thomas, thank you for asking. If a resident alien paying self-employment tax to earn Social Security credits, does the 5-year consecutive presence in U.S. still apply? The answer is yes, but it depends. So like when you answer all your questions as an attorney, you always use the expression it depends. And it depends on circumstances and whether they're applying to become a citizen. So there's a lot of finite rules there. Somebody that is a attorney specializing in immigration will know all of the details for that. Let's see, there's another question here. Yes, Larry, for supplements, which has the most coverage, F grandfathered or if no longer available, N? Well, I'll just give you a brief overview that Plan F covers all of the gap entirely, all of the features and benefits available. The only difference between a Plan F and the new one, Plan G, is the Medicare Part B deductible. So the Part B deductible today, 2021, is $203. And you pay that the first time you use health care. So for some people, they look at insurance as, I want to buy it and not have to think about it, and I don't want to deal with paperwork and claim forms and any of that hassle. I want the best I can buy and I'll just pay for it. And sometimes you can pay for it through your business or your corporation. There's a lot of variables there as well. But the bottom line is Plan F is the highest level of coverage. Today, Plan G is the highest, and Plan N is the one right below it. Very few people buy Plan N because, like Plan G, you have to pay the deductible. And then once you pay the deductible of $203, with a Plan N, you also have to pay $20 for every doctor visit. And if you go to the ER, you have to pay $50. So people don't like copays, they don't like claim forms, they like complete coverage. So today, unfortunately, Plan G does have claim forms, for the first time you're using it, and the doctor files that for you, but you have to pay that 203. I think that's all 5 questions that are on that side. Let me take a look and see if we close the box there. I don't see a chat, so I'm going to have to come out. I'm going to stop sharing, come back here, and now I can look at the chat. There's some chats over here. Let's take a look here. Oh, California, I'm corrected. They lost 1 congressional seat. I thought I heard 2. All right, so here, another question. What consequences would result if an individual retiree moves to live in a foreign country like Canada or Costa Rica, after a few years returns to the United States? This is an interesting question because up until about 5 years ago, there was a big trend to move to Costa Rica because everybody heard it's beautiful and they see it and they think it's low cost to live. Well, one of the details of Medicare is that Medicare does not cover you outside the United States. Medicare, the Medicare federal government, it covers you from the tip of Maine to the tip of California, the tip of Florida to the tip of Washington State, and up into Alaska. But you go to Canada, you're not covered by Medicare. You go to Mexico, you go anywhere else in the world, you're not covered by Medicare. So the supplements will provide foreign travel emergency coverage, which only limits the benefits that they pay up to $50,000, which is fine if you're going to Mexico or Canada, because if you got sick or injured and you need to get back here, you just need a short airplane hop to get you back here. It, depending upon where you are, it could even be a helicopter that brings you back. But if you're abroad, then 50,000 is never enough. So we have available something called travel medical insurance policies, very low cost, because you only insure the number of days you're gone and you insure only your body. Next question. I'm a law partner, a partner in a law firm that covers coverage for him and his wife. What happens if his wife's insurance, if he enrolls in Medicare and his wife is no longer eligible for the group insurance? Okay, well, that's a very easy question. That's what Obamacare is for. So choice number 1, he's covered as an employee, turned 65, and now he's got Medicare starting like me on April 1st. The wife is a younger wife, and she's only 64 or maybe even 54. Well, option number 1 will be COBRA for the wife, and that's probably going to be expensive, depending upon her age and the size group that they're in. If the group has a total of 20 employees or more, then the rate could be based on the age of that employee's wife. Or if the group is greater than 100 employees, it's based on what's called the composite rate. So there's a lot of variables here. COBRA is option number 1, and depending upon cost and timing, it may be appropriate. But more often than not today, COBRA is very rarely elected by anybody because Obamacare, the Affordable Care Act, is guaranteed issue. There are no health questions. And the number 1 reason a person elects COBRA is because they've got a health condition that is, in quote, pre-existing, and they're concerned that they may not qualify to buy insurance. So COBRA is still there to serve as a backup for that. I'm sorry, I forgot to answer the question about Costa Rica. I wanted to just do a little bit more detail. That if you're going to live in a foreign country, and I had a guy that left literally last Friday to move to England, no idea what he's going to do or how long he's going to be there, but he says, I'm out of here. And so that person, I told him very simply, Medicare doesn't cover you. So a supplement doesn't cover you other than $50,000, and you're going to be paying a premium for the Part B. So I advised this person in his situation to buy a foreign travel policy that will cover his travel medical only. He doesn't need trip insurance because he's going to be living in different countries. So in his case, he buys a 1-year policy, and it's not overly expensive. It's definitely less than $1,000 a month. It depends on the deductible you choose, but we have a solution for that. Let's see if there's any other questions here. Going back here. I think we're right on time for Terry and the rest. Let's see here.
That is correct.
Oh, there was a question here. What are the consequences for a person who fails to pay premiums? Well, I don't know which premiums that person is asking, Cheryl's asking about, but if it's the Medicare Part B premium, uh, that's a thing you don't want to ever do. You have to weigh your dollars of what you have in your pocket. You better pay that premium first, and then if you have money left over, then pay for food and your cell phone and anything else. Because if you lose Part B, you can only join it in that January 1st to March 1st, and then you will be subject to a 10% penalty for the rest of your life. If the premium you're concerned about is a Medicare supplement premium and you lose that coverage, that's real easy. You don't have coverage for the 20%, just look at your checkbook and your credit cards. That's where the coverage now will be found. And the good news is Medicare still paid the 80%, but now you're going to pay the 20% out of pocket. On the drug plan, if you lose coverage on the drug plan, then you have to wait until the annual election period, the same October 15th to December 7th. And when you join a new plan for the new year, no problem, you'll be covered, but you will have a late enrollment penalty for all the months you were not covered. Terry, thank you very much for allowing me the privilege of doing this again.
Thank
It's been
you.
a pleasure being with you. And anybody else that has a specific question, I put in my email address, my website, my phone number. Feel free to call me anytime you like. My office will gather your data. They'll reach out to me. I am working from home due to COVID, but I plan to be back in the office in the fall, and I can reach you by my cell phone. Thank you again, Terry. I'm going to leave it in your hands.
Very great presentation, per usual.
Thank you. Thank you for your kindness.
Thank you so much. See you next time. The blessing and curse of being a great speaker is you keep getting invited back. So
it's always a pleasure, and
I'm sure we'll be seeing you in the future too for another program and talk about changes, because there are always changes.
There's always changes, and I'll say aloha and mahalo from my background.
Okay, bye everybody. Thank you again, Barry.